Mary-Louise McLaws is an expert advisor to the WHO and a renowned infection control expert, and she joins us now from Sydney. It's really good to have you on the program, Mary-Louise. Now, countries across the globe are taking various measures, as we just mentioned there, to essentially stop the spread of the virus, whether it be travel bans or detailed screenings. How effective are these precautions that are being taken?
Look, we know that quarantining, that includes a travel ban, is probably one of the most important control measures or containment measures. Then the next one is to encourage your citizens to self-impose self-quarantining or self-isolation. So those two things are probably the two most important to try to keep the numbers of imported cases down and then the spread into the second wave.
Do you think the response to combat the virus is a bit late than what would have been preferred? We now see Australia bringing stricter screening controls of people entering their country from Italy, but it has been quite some time since Italy was announced as a hotspot of the coronavirus.
Look, yes, I mean, as an epidemiologist, I see things from my perspective, and that is go in early and go in hard and close your borders. It does upset your neighbours, though, but it's a very effective measure. But then the authorities have to weigh up the risk of your economic risk and the risk of infection and the success that that will do. But yes, certainly there were several countries that we could have included in our ban, our travel ban earlier.
So how long does it take for someone to be diagnosed, and within the time frame between when they actually get infected to the moment they get diagnosed, how many people would we assume has got into contact with them who could potentially be carrying the virus now?
Look, on average, one infected person can infect up to two, nearly three people, and in the perfect conditions that we call super spreading events, they can probably infect up to four. And the other issue is, apart from the infectivity, is that people who have a mild case are quite likely to be walking around and become infectious to others at about the fourth day after they start having signs and symptoms. So a headache or a little bit of a dry cough and aches and pains. They may think nothing of it, but what they're now doing is potentially infectious to others. So from day 4 to day 8, when they're infectious, that's usually the time when most mild cases also start to get better, by about day 8. But they have effectively infected others while they're improving.
Yes, so as an infection control expert, Mary-Louise, how would you advise people to not contract this virus? What should they do on a day-to-day basis?
Yeah, look, in Australia, we're advising people to not use masks because we have very few cases, and we are conserving masks for healthcare workers at the front line. What we are, and WHO is also supporting, is the idea of good hand hygiene. So when you go out and you've touched high touch areas where a lot of people in the community touch, make sure that you hand hygiene before you touch your face, before you start eating or preparing food, and also having good environmental cleaning. So, you're showing visions of very clean cities, but also doing additional cleaning of high-touch areas in shopping malls helps, and of course in the home.
Okay, thank you so much for that insight. We really appreciate it. Mary-Louise McLaws joining us from Sydney.